How do we harness this power, if you will, for brain?
So again, the brain is no different than any other part of the body. It's a tissue that the magnetic field goes into. So if you apply a coil to the side of the head, established magnetic field therapies that are FDA approved are approved for treatment-resistant depression using something called TMS, Transcranial Magnetic Stimulation. And they're put over the motor cortex. Over the motor cortex, the stimulation is increased to a point where you get contractions of the hand on the opposite side of the body. Once you get that, that's called the motor threshold. And the current protocols basically are to take that motor threshold, jack up the intensity by another 20%, and put it over the frontal cortex. So it's going into the brain, and as the magnetic field passes through into the tissues of the brain, it stimulates charge. And it's that charge production that causes that hand contraction. So it's powerful enough to go into the brain, and yet it's safe enough. Millions of people have been treated, millions of hours of treatment with PMS applied to the brain with no negative consequences fundamentally.